Walking on the streets in Beijing, you may notice these temporary structures. It's an abandoned PCR test booth. For one period of time, taking free PCR tests has been a daily routine for almost every Chinese. The rapid test allows health authorities to quickly sort out positive cases and take active measures. And that has become history, as China has shifted its measures from prevention to treatment.
过去3年，用很多网友的话说，国家和政府一直把大家严密地保护起来，尽可能地减少感染的这个人。 早期发现，然后切断这个传播的途径。那么现在由于这个病毒的毒力，它已经大大的减弱了，它的这个传播力快了，绝大多数的这个人群还是这些轻型的表现。
I'm at the district level hospital. It has been one of the top options when people caught a fever. The hospital staff told me that they're now under normal operation. The latest COVID-19 treatment protocol advises mild symptom patients to quarantine at home, which can reserve medical resources for critically ill patients. It makes sense with Omicron, but at the very beginning of the epidemic, the variant was way more deadly. I was a reporter in the central Chinese city of Wuhan when it was under lockdown. Back then, the novel coronavirus was wreaking havoc. China locked down the city's 11 million residents.
Just outbreak in Wuhan and Wuhan area, so not happen in other area. So we cross that down. It's very useful in dealing with this acute infectious disease. The best way, the oldest way, and the best way is to isolation.
And then China gathered its best resources at the epicenter. More than 40% medical staff and 300 medical teams from around the country traveled to Wuhan. Workers build new hospitals, community members conduct contact tracing, and volunteers delivered supplies. 94% of people infected during the hardest hit time were cured.
If we do not respond quickly, it will become a national disaster. So the scientists, the government officials recognize the urgency, and we all worked very hard day and night to get that done.
Wuhan went back to normal after 3 months of lockdown, but it's a different story for the rest of the world. To reduce resurgence, China had in place a dynamic zero-COVID policy, applying methods used in Wuhan to put out another 100 outbreaks in 3 years.
Community-level public health facility in China is very, very strong, comparing with any other countries. This is the basis for this zero-COVID strategy. At least we contribute something for the international public health. China is another example what we can do in the future.
The dynamic zero-COVID policy sought to keep the infectious low, to not allow it to put a halt to the society. China has waited for a time to optimize its measures.
第一个还就是病原体的它的致病力确实是发生了明显的变化，在下降。第二一点，我们整个中国人的主动免疫的这个水平在明显的提升。像我们的疫苗的接种，特别是对老年人的一些高危人群的疫苗接种比率达到了一定的要求。另外呢，我们从药物的一些手段，同时我们对重症救治的一些资源的准备等等各个方面综合分析来看，是一个机会。
3 years on, China is more prepared for its battle against COVID-19. More than 90% of the Chinese population is fully vaccinated, among the highest rates in the world. The total number of ICU beds in China stands at 216,000. There are 128,000 ICU doctors and 333,000 nurses.
在重症、危重症的救治上，我们的经验更加丰富了，我们的点呢找到更加准了。
This is a shopping center in downtown Beijing. You can feel the Lunar New Year atmosphere. Normal life has gradually returned. China has sought to reduce the economic impact from the epidemic. Policies to support enterprises has been introduced at both national and local levels. China was the first major economy across the globe that registered growth in 2020. The past 3 years saw economic growth averaging 4.5% per year, which is significantly higher than the global average. COVID-19 has taken millions of lives worldwide, and China has been one of the places kept safest from the deadly virus. It has kept severe cases and death rates among the lowest in the world. Chinese President Xi Jinping thanked medical workers for their hard work.
这一波的这个疫情啊，爆发得很猛，来得很快。广大的医务工作者一直在防护疫情和日常治疗这两线作战，长时间、高强度、超负荷的工作，为确保人民生命安全和身体健康，你们做出了重大的贡献。
From Alpha variant to Omicron, China is a fast learner and responds quickly to multiple waves of challenges. The COVID measures have been consistent and have been effectively applied with commitment from medical staff, scientists, community workers, and people from all walks of lives who have been dedicated to serving the safety of the people. Zhao Yunfei, CGTN.